Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP. Today we are talking about Lumateperone, also known by the brand name Caplyta. Before we get started, remember that this education is for learning purposes only. It does not replace medical advice, diagnosis, or treatment from your healthcare provider. Please do not start, stop, or change any medication without speaking with your prescriber. Alright, let's talk about Caplyta. And don't worry, we are going to keep this simple. We are not here to turn dopamine, serotonin, and glutamate into a pharmacology family reunion where everybody is arguing over the microphone. We are here to understand the medication in a way that patients, families, students, and providers can actually use. No unnecessary big words, no confusing medication gymnastics, just clear education with a little fun. Next, we will cover the following topic. What is Lumateperone? Lumateperone is a second-generation antipsychotic. It is also called an atypical antipsychotic. It is known by the brand name Caplyta. In simple terms, Lumateperone helps regulate brain chemicals involved in mood, thinking, perception, motivation, and emotional balance. It is not a stimulant. It is not a benzodiazepine. It is not a sleeping pill. It is not a medication that instantly fixes depression, psychosis, or mood symptoms in 5 minutes. Caplyta is more like a brain signal adjuster. It helps work on several important communication systems in the brain, including serotonin, dopamine, and glutamate-related pathways. To better understand how this works, think of the brain like a soundboard. Serotonin is one knob. Dopamine is another knob. Glutamate is another knob. When the sound is distorted, too loud in one place, too quiet in another, or full of static, symptoms can show up. Caplyta helps adjust the soundboard. Not silent, not chaotic, more balanced. Next, let's explore what is Caplyta used for. Caplyta may be used for schizophrenia in adults, depressive episodes associated with bipolar 1 or 2 disorder, and adjunctive treatment of major depressive disorder. In schizophrenia, Caplyta may help reduce symptoms such as hallucinations, delusions, paranoia, and disorganized thinking. In bipolar depression, it may help with depressed mood, low motivation, low energy, and feelings of worthlessness. A patient may say, "I am not manic right now, I am depressed," or "I need help with depression without triggering mania." A simple teaching line is, Caplyta is an atypical antipsychotic that can help with schizophrenia symptoms and bipolar depression by helping regulate brain signaling. Mechanism of action: how Caplyta works in the brain. Caplyta has a unique mechanism. One of its major actions is strong serotonin 5-HT2A receptor antagonism. It also modulates dopamine signaling. Caplyta is thought to help balance dopamine rather than simply slamming it down everywhere. It may also influence glutamate-related pathways, which is one of the brain's main excitatory messengers. Now here is the fun version. Imagine the brain as a busy group chat. Serotonin is trying to keep the conversation calm. Dopamine talks about motivation and reward. Glutamate says, "Everybody wake up." In schizophrenia or mood disorders, the group chat can become chaotic with messages sent too loudly in the wrong channels. Caplyta steps in like the group chat moderator and helps organize the conversation. Better signaling, better stability. Moving on, our next section is Caplyta and schizophrenia. The goal is not to make the patient emotionally flat or sedate them into silence. The goal is clearer thinking and better functioning. Medication is one part. Support, therapy, sleep, and family education all matter to help the person rebuild function. Now let us move on to look at Caplyta and bipolar depression. Bipolar disorder is not only about mania. Many patients suffer deeply from the depressive side, feeling low, slow, and hopeless. Bipolar depression can feel like the emotional Wi-Fi is down and the password no longer works. Caplyta may help restore that connection. Traditional antidepressants may sometimes trigger mania in bipolar disorder. Caplyta offers another option to help without that risk. Now let's look at Caplyta and depression add-on treatment. A patient may say, "My antidepressant helped some, but I still feel stuck." In that situation, a provider may consider an add-on, but adding medication means adding monitoring. We do not add medication and disappear. That is not treatment. That is medication hide and seek. starting dose, titration, and maximum daily dose. One thing that makes Caplyta simple is the adult dose is fixed, commonly 42 milligrams once daily. There is typically no titration required. Patients do not have to climb a medication staircase starting from a lower dose. However, dose adjustments may be needed when used with medications that affect CYP3A4. The liver enzymes are still in the room. How patients usually take Caplyta. Take it once daily, with or without food, at the same time each day. This is not a medication for bad mood days. Consistency is key. Let us now review the common side effects associated with this medication. Common side effects may include sleepiness, sedation, dizziness, nausea, dry mouth, and fatigue. Most patients do not get every one. Be careful with driving or operating machinery until you know how Caplyta affects you. Don't silently suffer. Tell your provider. Now let us discuss the important metabolic side effects. Caplyta has a different profile than some others, but we still monitor weight, blood glucose, and lipids. Lower risk does not mean no risk. It is also very important to watch for movement side effects. Monitor for restlessness, tremors, or stiffness. Report abnormal face, tongue, or hand movements early. Don't wait for approved choreography. Please pay close attention to these important safety warnings. Antipsychotics carry a boxed warning for elderly patients with dementia-related psychosis. Caplyta is not approved for this use. Patients being treated for depression should be monitored for suicidal thoughts or unusual behavior changes. If in danger, call 988. Neuroleptic malignant syndrome, NMS, is rare but serious. If you have high fever and severe stiffness, get medical help now. Tardive dyskinesia involves uncontrolled movements. Report these early, as they can sometimes become persistent. As a safety note, Caplyta may increase fall risk due to dizziness. Stand up slowly. Use caution with overheating and report any swallowing problems. Stay hydrated and avoid strenuous exercise in very hot environments. Let us take a closer look at potential drug interactions. CYP3A4 inhibitors can increase levels, while inducers can lower them. Tell your provider about all supplements and medications. Here are the important pregnancy and breastfeeding considerations. Tell your provider if you are pregnant. Late exposure may cause newborn symptoms. This is a risk-benefit conversation, not a panic decision. Finally, here is what families should understand about the treatment. Families can help watch for mood changes, sleepiness, and abnormal movements. The goal is to support the person's life, not erase the person. Let us summarize the key teaching points for today's lesson. Number 1. Caplyta is lumateperone. Number 2. It is used for schizophrenia and bipolar depression in adults. Number 3. It affects serotonin, dopamine, and glutamate signaling. Number 4. A common dose is 42 milligrams once daily. Number 5. Review drug interactions. Number 6. Monitor sedation and dizziness. Be cautious with driving. Number 7. Monitor metabolic health. Number 8. Watch for and report abnormal face or body movements. Number 9. Remember the dementia-related psychosis warning. Number 10. Keep education simple for the patient and family. In conclusion, let's bring it all together. Caplyta is not magic. It is not a personality eraser. It is a tool to help regulate brain signaling when used carefully. When combined with therapy, support, and healthy habits, it can be very helpful for selected patients. Thank you for watching. Again, my name is Dr. Osevwe, DNP-PMHNP. For support, you can text 8329916516. Please subscribe to our YouTube channel and join our mentorship family today at rotationmatchnetwork.com.